My name is Tammy Nguyen. I'm a nursing student at Briar University with my partner Jessica Fitzmaurice. So we are doing pain relief with CBD for our abstract research poster. So in our PICO question, we are asking, in adults with chronic pain, is CBD a superior pain relief measure rather than opioid painkillers in the reduction of pain level with fewer complications?
And as we look as the introduction, I'm Jessica, by the way, like Tammy said. So healthcare providers, pain management is one of the most imperative duties in improving patient outcomes, as well as quality of life for patients. So a little background, in 1990, pharmacy companies claimed that painkillers were not addictive, and this led to a major increase in opiate painkiller prescriptions. Then it led to an extensive misuse and abuse epidemic of these medications. These medications can be addictive for some, so the epidemic carries various consequences such as overdoses, opiate-dependent infants, and can also be a gateway to heroin use. The use of CBD for pain management is growing, and many believe that CBD is a superior treatment for pain compared to opiates because it provides pain relief faster with less side effects and is less addicting.
So we have more additional information. There are two types of main receptors for CBD. It is CB1 and CB2. When CB1 is activated, the receptors in the central nervous system influence cognition and pain signaling. The CB2 receptors are located on the cells. This helps reduce inflammation, which then helps reduce the pain level related to it. And so for our methods, we terms such as CBD pain relief, CBD and pain, to identify articles published between 2015 and 2020 in the CINAHL database. CBD articles were reviewed for this project. The side effects of opioids were found using a pharmacy book. Furthermore, website articles were used for back information, and the credibility of such sites were evaluated on author and organization merit.
All right, as we dug deeper and we found that CBD has anti-inflammatory effects. It reduces joint swelling for pain and diseases such as rheumatoid arthritis, and patients do not develop a tolerance to CBD as patients develop a tolerance to painkillers. So CBD is neither intoxicating or rewarding, making patients less likely to become addicted to it, unlike opioids, which stimulate the reward pathway in the brain, putting patients at risk for addiction. So CBD can also have some side effects such as fatigue, changing in appetite, and weight gain. However, there are no major side effects on the central nervous system, the mood, or the vital signs. CBD has also shown to reduce neuropathic pain and visceral pain as seen in rheumatoid arthritis, multiple sclerosis, Crohn's disease, and IBS. So some opiate side effects, they include respiratory depression, urinary retention, sedation, constipation, or tolerance.
And finally, we are going to our conclusion. Both opioid painkillers and CBD are proven effective in management. However, the resulting opioid epidemic due to the addictiveness of opioids make them inferior to CBD for pain relief. In addition, the side effects of opioids are more damaging than the side effects of CBD, therefore making CBD a superior pain measure.
All right, now as we look into this picture in the middle, I will blow it up for you guys. So it's just more information and findings. So it says CBD has numerous health benefits, like we said. It treats neurological, abdominal, physiological health conditions, including epilepsy, anxiety, depression, PTSD, and more. The CBD levels out THC's negative effects. So studies have found that CBD lowers verbal memory inhibitions, enhances recall memory, and reduces THC, induces anxiety. CBD is legal in the U.S., some places. So CBD high cannabis products with THC content less than 0.3% are allowed in the U.S. nationwide. Okay.
It is non-addictive according to the WHO's Committee on Drug Dependence. CBD is a non-habit forming substance. And WHO is the World Health Organization. CBD can be extracted using methods: high pressure, high temperature, or CO2. CBD has several consumption methods. So those are studies have found that CBD is effective for treating neurological, abdominal, psychological health conditions, epilepsy, anxiety, and PTSD, as Jessica further mentioned. And finally, CBD can be used for pets. It has been found effective for the treatment of pain, inflammation, and anxiety in pets.
And that is our presentation on pain relief with CBD. So, as you all learned, it is very beneficial. And that wraps it up. Thank you. Bye.
Thank you.